Healthcare providers who perform toxicology screens have a new option to streamline the process of specimen collection while yielding more accurate results. The AMS device card is a patented microsampling device specifically designed for the collection of dried biofluid specimens, allowing for quantitative analysis. From just 3 drops of capillary blood, our laboratory can perform therapeutic drug monitoring, plus level determination of prescribed medications. Urine has been used historically for toxicology testing because of the ease of collection relative to phlebotomy. Plus, less sensitive methodologies were easier and cheaper to use than those required to measure lower levels of blood. However, concentrations measured from blood enable physicians to accurately determine both that a patient's dose yields a concentration within the therapeutic range and is below the toxic threshold. Data from blood testing is used to make drug approval determinations because it's the most accurate assessment of bioavailability and pharmacokinetics. Urine levels do not provide the same information. Now, with the advent of accurate DBS with mass spec analysis, there are no longer any acceptable reasons to continue using urine. In fact, the National Institute of Health conducted a study that looked at over 25,000 patients, examining the relationship between the concentration of hydrocodone and its conversion to hydromorphone in chronic patients using urinary excretion data. The study showed a huge variability between patients. For a given patient, there will be a 23 times variation in the results from one test to their next test. And between patient to patient, there is 134 times variation in results when those patients are taking the same dose. Many factors contribute to how some drugs get excreted, including how much water or liquid a patient drinks coupled with metabolism, which can skew results. Blood is not as affected by these factors as the variability occurs after the drugs leave the bloodstream. The benefits to healthcare providers for using DBS for toxicology testing are clear. DBS devices streamline the sample processes. It eliminates handling, storage, and shipping issues like leakage and subsequent recollection. It eliminates the need for specialized collectors like phlebotomists and the need for restrooms. It eliminates adulteration opportunities, which improves lines of communication between the provider and patient. The collection method is easier, especially for apprehensive patients, the elderly, and pediatrics. It provides therapeutically relevant cutoffs, reduced by up to 80% from those in urine. And the samples can be held for 30 days as opposed to 7 days for urine.